This has been 48 hours. Honestly, this is the worst swelling I've ever had. I'm about to wash my face. It doesn't look like peeling. I don't know what that is. This one's been rough.
We're Nathan and Tiffany. We own a wellness practice where we have dedicated our professional lives to helping people achieve, maintain, and enjoy wellness. We also love a great adventure. This is the channel where those two loves align.
Good morning, early morning. It's 2 o'clock in the morning and I am about to start the process of doing something called PDT or photodynamic therapy. I apologize if there's an echo in here, but I'm in my bathroom and I have to apply a topical agent that is called Imiluz. This little teeny tiny tube, I think, if I remember correctly, costs $350. This is a photosensitive medication that is attracted to something called actinic keratosis, which is essentially precancers. And the reason I'm doing this video is in case anyone else is interested or has an issue with actinic keratosis and or skin cancer. So I'm a redhead, I'm 45, and my very first experience with my first precancer, I was 22. It was on I believe it was my left shoulder. It looked like someone had burned me with a cigar. So I went to the dermatologist and they told me that it was a precancer. And at that time, I treated it with something called, I can't remember what it was, but it was a topical that I put on for 21 days, I think it was. Got really red, scaly, and then it went away. So I've been seeing a dermatologist every year, if not every 6 months ever since. And at one point she would, freeze off with liquid nitrogen, these little actinic keratosis. And she finally said, I need to treat your whole face preventatively because I'm either gonna miss something, it's gonna start scarring your face up really bad. For the next 48 hours, I cannot expose myself to any light at all. I'm gonna show you some of the products that I keep on hand for the recovery. I use Dove soap to clean my face. They say use any cleanser like CeraVe, Cetaphil, but I find that with all this greasy stuff that I have to put on my face when I go to clean it the next time, that those cleansers just don't make me feel clean. You do feel really sticky and gooey and yucky. So the Dove soap has worked well for me and I've gotten the blessing for using that. CeraVe moisturizing cream, lots of this stuff. I use this anyway. This is my moisturizer for my face and my body anyway. So most of the stuff is actually not any different for me. It's just the volume in which I use it. CeraVe healing ointment. This is what they recommend to use. You can use Vaseline, you can use Aquaphor, you can use CeraVe, but they prefer this one. I think it's because it has fewer ingredients. I normally prefer Aquaphor over this. It's I just find it to be, it's thicker. This one's thicker. So, but I do what they tell me to. So they say to put this on. This is what I will keep as like a protective barrier. My face will all be greasy and Vaselined up for several days. When I do start going outside, I wear sunscreen every single day anyway, but you have to wear sunscreen for several weeks because you cannot get exposed to light. You will get fried. So this is my personal sunscreen of choice. Any of these products, I'll put in the description box below if that's something that you want to have. Out of all these products, they're all very inexpensive except for this one. My dermatologist wants you to use a zinc oxide sunscreen that has at least 7%. So it's a physical barrier, not a chemical barrier. Honestly, I can't even imagine how uncomfortable it would be to put chemical sunscreen on my face after I do this because it's so raw. But I'm going to show you sort of the healing process. It's not pretty, but the more actinic keratosis you have, the more the swelling and response will be because the medication is specifically sensitized to those cells. So the first time I did it, it was bad. I tell people I looked like a Shar-Pei. The left side of my face was so swollen, it was like hanging. My lips were like pulled inside my face. My eyes were nearly swollen shut. And so it was pretty bad. And since then, it's usually not such a severe response. It's been 2 years. I'm hopeful it's not going to be too bad, but it also depends on what she chooses to use as the activating agents for the year. You're supposed to sleep sitting up for a couple of days for the swelling, drink lots of water, and do not pick or scrub your face. And it's really hard because eventually it's all going to peel off. Another positive note is there is some cosmetic benefits to this. So over the course of the next month or two, there's usually some collagen and elastin production. My skin will obviously get a huge exfoliation, and it, you know, some of the discolorations will be will fade or will be sloughed off. So there's some cosmetic benefits to doing this as well. So that makes it even more worth doing. But ultimately, I do it for the cancer prevention treatment. So I've literally been using Dove soap to clean my face and my body. I actually used it for my face and my body I'm gonna go right over my eyes, so I'm gonna close my eyes. Gosh, 30 years. This is the part that always freaks me out. The idea of putting acetone straight on my face. It's weird. I'm about to put a medication on my face and that doesn't freak me out. But for some reason, this acetone thing freaks me out. Just knowing that it can take nail polish off of my fingernails, which is like a paint, just feels wrong to be putting on my face. And I believe it's because they want all of the oils off of your skin. Something to do with the activation of the medication. But I'm gonna move to the side a little bit so I can see what I'm doing. I mean, I'm keeping my eyes closed because I definitely don't want acetone in my eyes. Oh my gosh, it just smells like something you should not put on your face. Oh, it just feels unnatural to do this. Okay, I think that's good. Yuck. All right, so now I'm going to turn the light off. Actually, first I'm going to open the tube. I used to use a medication called Levulin. I believe that was a 20% solution of the same primary medication, and you had to like pop the ampules and shake it together. I don't know why she switched. I know at one point it was really hard to get Levulin, but I have no idea now. So lights off. I open the door. I can maybe get a tiny bit of light from the hallway. Oh, that's weird. It looks like there's more light than there is, but you want to use the whole tube. This stuff is real expensive, so you don't want to waste any of it. It just feels like a gel. This does not sting or burn in any way, unlike the acetone, which feels like you're putting acetone on your face. You're not supposed to put it on your eyelids, but they tell me to get it close in my under eye, but not too close to get it in my eye. Don't get it on your lips. And then I think she tells me to go like under my chin, which if anywhere, I kind of want to do it. I wish she would do the tops of my ears, because you know what? I'm just going to put some on the top of my ears just in case she feels like being nice, because you know, a lot of people get precancers on the tops of their ears. Men who are balding, this is also done on the top of their head. It actually feels like it's a lot of product. And I'm getting it right up into like my hairline. Again, you want to try and get it to the places where people get precancers. So like where I might miss sunscreen. A lot of people have more precancers on the left side of their face from driving, where their arms, I don't believe this product can be used on your arms and chest and stuff, but I believe that Levulin could. I've never had anything but my face done. All right, I think that's it. I'm gonna wash my hands. And now I have to spend the next couple of days basically in the dark. I will show you guys my little getup when I have to go to the doctor's. So there's a mild tingling. I would not call this pain at all, especially compared to what you're gonna do with this laser treatment. Just a little bit of tingling. All right, I'll see you in a little bit, a few hours. So if you thought I was exaggerating about the outfit, this is it. I know, it's hard to believe that I'm being serious right now. You have to cover up your skin because you can't get any daylight on it. So can you imagine driving like this an hour and there and back? Drive conservatively, that's my advice. So now I'm at the doctor's office and I had to wash off the medication, and now there's this cream on my face to help it numb. The problem is that I'm a redhead, and for those of you who don't know it, we don't always respond to analgesics normally. So I've only ever had numbing cream one other time, and it helped maybe a little, I don't know, but we'll see if it helps take the edge off. Either way, I can do it with or without the numbing cream. I've done it tons of times without. These are all the lasers. Still in a dark room. Getting ready to get started. How can someone take me seriously like this? This is this like CO2 thing they put on me this time, and this like hat they gave me. Oh my God, I don't even know. It is so ridiculous looking. Yeah, I'll keep you posted. This is that CO2 mask that they put on me. It is driving me insane. She said it would peel right off. Apparently that's true. I am now at home. I did not film the actual laser treatments because, you know, I didn't necessarily have their consent. So I'll kind of talk you through it. Oh God, this is gross. There's 3 different kinds of lasers, and this time, you know, every year I do it, she changes it a little bit. I just kind of go with what she thinks is best. It was 3 different kinds of lasers and a red light for a couple minutes. The red light gave me a little PTSD. I've met Vixia in the past. Oh, this is, I don't think that's gonna just peel off. I think I need to wash that off. Gosh, so weird. They've never done this before either, the CO2 mask. Oh, it's like in my hair. Your hair gets really gross because you have to keep putting all these like greasy creams on, and I think I'm gonna have to wash off the rest of it. Yeah, okay. Y'all, I can't get it out of my hair. Oh my goodness. I don't even know if I still got that mask off. I'm not sure that I like that. Now what I'm gonna do is I'm gonna try the vinegar rinses that they recommended. Jeez, it's all in my hair. So I have 3 cups of water and 1 tablespoon of vinegar. It's very cold. Oh, that does feel good. You can't scrub your face at all. The best way to describe it, it feels like the worst sunburn you've ever had. If you burn. Some people don't. When you're a redhead, you probably had a few sunburns in your life. Now I smell like salad dressing. You gotta put on like a really, really greasy emollient cream. So I'm using that CeraVe moisturizing cream. And I'll put this on so many times today. And then at night, I'll use the healing ointment. It's like a Vaseline-based product, and so it feels really gross to sleep in. You're supposed to sleep with your head in bed elevated a bit to help with swelling and stuff. It's hard. It's hard to sleep like that. There's a couple of spots that are pretty tender. So this is what it looks like about an hour after. I would take you out in a more well-lit area, but I'm not supposed to. I'm actually going to turn these lights off pretty quick. I'm going to put some healing ointment on my lips, and we're done. So this is just about 24 hours in. You can see how much swelling there is, especially on the left side of my face. I'm not gonna lie, it's not comfortable, but it's kind of hard to move my mouth because I'm so swollen in my eyes. So this has been 48 hours. Honestly, this is the worst swelling I've ever had. I'm gonna come in a little closer. I'm about to wash my face. It doesn't look like peeling. I don't know what that is. This one's been rough. All right, it's been 72 hours now. So I'm now on 2 medications. One is a diflucan because this stuff yesterday was yeast colonization, and then a steroid pack for my swelling. This is handedly the most severe response I've ever had in all the treatments. So I don't know if there's an irony in me documenting it this one time. The swelling is finally coming down a bit. It's still pretty bad. And now it's progressing into the phase where things get really hard and tight. So it feels like there's like a hard crust that's formed, especially over like the middle of my face, which will eventually start cracking and peeling. At this point, the redness has gone down a lot, and it's finally starting to come down a little bit here and a little bit here, but not much. Definitely not much. Okay, we're on day 5 now. The swelling has gone down a lot. I'm starting to look more like myself. Now I have this like hard, it's almost like a crust over my face. This is all gonna start peeling off, and you can see some of the redness is starting to fade, but This is taking way longer than usual. And then the area where I had the yeast colonization is almost like re-healing because it was very raw underneath. So this is like healing round number 2. Here we are, day 5. All right, today is the beginning of day number 6. So this is where the redness is coming down, the swelling is basically gone, and now I'm really starting to peel. Like this hard stuff is starting to crack and peel off. So it should look a lot better over the next couple days. Thank goodness. All right, day 7. This is so much better. I have like this little bit right here that's still peeling, and then where I had that yeast colonization, it has like a secondary, it's gonna peel a second time. But otherwise, the redness is going down. I'll get you some pictures in my hair. But still, like, I gotta be careful when I smile. My skin's still like kind of cracking and whatnot. But the pain is way down. It's getting much better. All right, things are really starting to turn a corner. So today is the first day. I have taken a shower, but it's the first day I'm going to wash my hair and leave it down. And I'm going to show you how far we've come. It is not fully healed, but I'm standing near a window and getting a little bit of exposure to light. This is day 8. Okay, today is the first day of second day I've been in any sunlight. It is 9 days now. So I'm healed up mostly. I'm still very red. And I'm going to show you, I have this cream that I've used in the past called Cicaparis Tiger Grass Lotion that is like soothing for irritation, and it has like a red balancing. And I will show you what that looks like. It's a sunscreen, SPF 30. Kind of like the other sunscreen. It's pricey. But if you want to, I'll show you how much that helps. But you can see like, it's just like red now. But the majority of the healing has taken place. So I'm getting in the sun so you can see how much that like Cicapair sunscreen really does help. I don't look nearly so red anymore.
All right, this is probably going to be the final follow-up for my PDT treatment. I'm putting myself in really direct sunlight. It's very unflattering, so you can see really how I've recovered. All I'm wearing today is sunscreen and I think some brow gel, nothing else. So I'm going to show you in this sunlight all the way around. As you can see, there's still a little bit of redness here where there was the most trauma. I hope that you guys found this video helpful. If for some reason you are struggling with actinic keratosis and you need to have this treatment, I hope that helps prepare you for the recovery. Also, if this was helpful, I'd love a like, a subscribe, or a friendly comment. Thanks so much. Bye.